Hi, everyone. I'm Shirley Farrar, and this is Encouragement on Fire. And today is podcast number 56, and we are still talking about obesity, a chronic disease. And I want to say to you, thank you so much for tuning in. So today we're always going to start every time we do our session. We're always going to do and encourage, going to talk about cancer and how we can be more aware of some issues that are going on, as well as how we can really concentrate on becoming healthier in this process. So today I wanted to bring to your attention some information. This particular information comes from the National Institute of Health. And for 2023, they have already projected that there will be about 1,958,300 new cancer cases, and there will be 609,820 deaths just this year from cancer alone. So it's really important that we create this awareness across the United States, not just, on our online portal or some information in a doctor's office. It's really important to me that I continue on the podcast talking about cancer and how it affects the lives of millions of people. So another fact that I want to bring to your attention in our Encourage Minute is that the American Cancer Society, they have online, you can go there, and it says facts and figures for 2023. Black men have the highest overall cancer mortality rate, and that is about 216 per 100,000. And that's 18% higher than white men. And also in prostate cancer, Black men almost double the numbers from every other group. So I just wanted to give you that fact today. Next week, there will be another fact, but I just want to make sure that you're receiving the information that if for some reason you have the history in your family or you're not eating right now, this is an encouragement for you to say, small changes in my diet, going to see my doctor annually, doing whatever it is that I need to do. And so I'm encouraging you to do that. So today we are talking about occupations of someone who would help you if you are going through obesity. And you know what? I even want to go even further than that with someone in their occupation, because not necessarily does a person have to be obese. It can be that their weight, you're going through some issues, some problems. And so I'm just, being transparent again that right now I'm in the process of seeing one of these specialists. And so I want to really share this information with you online. The first thing I want to do is I want to recap what we have been talking about. Today is about obesity, and we have been discussing the BMI, which is the body mass index, and that is a calculation of your height and how much you weigh. And that is calculated. I told you can go online, Google. You can use the online calculators. You can even talk to your doctor in regards to that. I definitely encourage it. But obesity can cause many problems, as we talked about in our previous podcast. So please, if you have not been with us in the past few weeks, you need to go back and you need to review some of that information. But it can cause so many different things: joint pain, death. It can cause some cancers. It can cause arthritis. It can cause heart problems, right? Diabetes. There's so many different chronic diseases that happen simply because there's excessive weight gain. Okay. And lots of times when you look at someone, you may not think that they're obese, but based on their height, and their height and weight, they are, or they're on the cusp of it. And then they have to do something in regards to that to not be extreme obese. Okay. Let me go on, because I also want to let you know that statistically, a third of the United States is considered obese. So I want us to really think about that. A third. So look at three people next to you. Look over to your left. Look over to your right. a third, meaning 1 out of the 3 are considered obese in the standard that they have for the BMI. And that to me is too many. So we need to make sure that we bring awareness to that. This is a huge epidemic. This is really a disease. But today we're talking about the occupation. So I went on several of the occupational handbook. I went on WebMD. I went on different occupation websites, and there were a few of the occupations that I pulled for you today because I thought that they were really important. If you even think that you have a weight issue, or you think that you may be obese, or you say I really need to get in shape, my first thing is always go see your doctor immediately. That is what you should do. So the first occupation that I want to bring attention to is an endocrinologist. Okay. This particular individual specializes in treating disorders of the endocrine system. So when we think about the endocrine system, what is that? Well, it's a network of hormone, producing glands in your body. There are individuals that go to school for this, and they're talking to you about the 50 different hormones in your body that are very complex. They're talking to you about your moods, all of these things they study, your reproduction, the metabolism in your body, all of these things. I know these are key words that you're saying, wow, now that sounds familiar. Metabolism, right? Hormones, all these different things. Well, this individual, the endocrinologist, they go to school between 10 and 16 years, some even more. And let me tell you their process. So remember, everyone has to finish your high school, but then you go to college, you get your bachelor's degree, right? And it's going to be science related. Then this individual, not only that, sometimes they get a master's in something dealing with science, but then they end up going to medical school, right? Or sometimes they just go straight from their bachelor's into medical school. They also have to do some type of internal medicine in that, maybe pediatrics or gynecology, something and related to that. But this person does 4 years of college, 4 years of medical school, 3 years of residency, right? 2 years of fellowship. And they still have to get additional experience and to be able to be qualified in order for them to be able to treat individuals. So I'm saying to you, this is a long time to be in school, but it's necessary. It's necessary for them to go to school this long so then they can be able to help you with your hormones, right? To be able to help you to understand your metabolism, your reproductive system. And this is someone that I believe that is necessary for me. So I've made an appointment to be able to see this individual to make sure that I'm taking care of myself and that I am not I don't remain overweight, or I don't remain on that scale going towards obesity for my height and my weight. See, everyone is different. So then I have the next occupation, and that individual is a gynecologist. Now, I know to my men who are watching, I'm not talking to you, but you may have a significant other in your life. So it's really important to even know about this information. They basically go to school, and I'm talking about also college, undergraduate. So I need you to understand that. I'm not talking about high school. High school is a given. Everyone has to do that if you're going to be a doctor of some sort. But I'm talking beyond your high school. I'm talking about all of your college, all of your clinical, all of those different things. And individuals that actually go to a gynecologist would be someone who is between the age of 15 and 45. But I would say it's between 15 and 60 or 70. People are living longer lives. People are very active in their intimacy, all of those things. So I would have to say it's well into their 80s that they still need to see a gynecologist. Okay. And then this is a doctor who specializes in female reproductive health, uterus, fallopian tubes, all of those things, ovaries, and breast tissue. So, we're always promoting, we're always making aware that it's really important for each of us as women, as young girls or who are maturing into young women, that you go and have a annual breast exam. If you can't do it every year, then it's a bi-annual breast exam. The point is to make each other accountable, that you have to go and get these exams. It's really important for us to catch cancer cells early, to stay, alive, to stay healthy, because doctors tell us all the time, you can change your health by what you are eating. You can change your health by adding additional exercise. You can change your health by minimizing your stress. There are so many things that we can do. So we need to make sure that we are doing all that we can. Okay. And this particular individual assists with Women Matters. However, if you are a woman and you believe you are very hormonal and you are going through obesity, or you're on the cusp of a lot of weight gain, I encourage you not only to see the endocrinologist, but you should also see your gynecologist, because the gynecologist is well versed on hormones as well and is able to test you for various things to find out if that is the matter as well. And remember, they can work together. So not only are you having your regular family practitioner, but your family practitioner is going to say you need to see a specialist, which would be the endocrinologist, or even sometimes the gynecologist. So I'm just saying, if all the doctors are working together in this process, it's going to help you to be healthier. And isn't that what we want? Isn't that what Encouragement on Fire is about? I'm encouraging you that you can be healthier simply by going to see the doctor, if you are able, right? If you're not able, then you need to contact us, so that if you're close by or it's in your community, we can then send you information or get you a number or send you some type of resource that you can then get additional assistance. Okay. This particular gynecologist, like I said before, goes to school above high school, into college and med school and certifications, residency, right? They have to be board certified, just like the endocrinologist. And this individual goes to school about 12 to 16 years. Again, there's no difference. Now, imagine going to school 12 to 16 years. I know a lot of times people, some people in some of my inner circle, they don't necessarily always trust doctors. And, no one is 100%. No one is perfect. But I would have to say, if someone went to school that long, surely something they had to say, at least 80% of what they had to say, I could trust that, you know? Now, is that everyone? No, I'm not saying that. There's some people that, are not trustworthy. But overall, if a person went to school that long, if you ask the right questions, they have to say the truth. They can't lie to you. Think of it that way. So if you are doing your research, if you're actually doing your research, remember, it's not just, we can't just put it on the doctor. We actually have to do our own research. And with our internet services now, you can even go to the library and you can look up all kinds of information. You can read books, look up all kinds of information. If we're doing our research and we're finding out different things about our health, If you ask the right questions, the doctor cannot lie to you. They've taken an oath that they have to make sure that they help you. Okay? Because sometimes there's things that they may not have said to you, but it doesn't mean that they didn't want to tell you those things. It's just that that moment didn't come up, or they didn't have that resource in front of them so that they could tell you that information. So I'm saying to you, do your research, ask questions. Remember, we said write those little notes, find out all the information that you need to know, and start asking those questions. And if there's a doctor that you're talking to and they're trying to get you in and out of that office and they're not taking time out with you, a regular doctor appointment should be no less than about 20 minutes. So you should have your list of questions, and that doctor should be able to answer those questions. If the doctor is rushing you out and they don't want to answer those questions, you should find another doctor. You should find another doctor because they are being paid to help you to be healthy. Okay? And if you feel at any time you're being rushed, find another doctor. Every doctor that I had did not rush me out. Okay? I think I had one, that rushed me out, and I changed doctors. So I'm saying to you, advocate for yourself. Okay? All right. Now, I also want to say that there is a third occupation that I wanted to tell you about today. And that particular occupation is, and I want to make sure I say this right, is a bariatrician or a bariatric healthcare provider or a bariatrician surgeon. So we know that the minute you put surgeon on there, that's additional years of education. So if you were a bariatrician or a bariatric health provider, this particular individual would have 16 to maybe 20 years of education. I'm assuming that if it's a surgeon, someone who is really specialized in operating, that probably would be additional time added to that. And how much schooling does this individual have to go through? When we say the 16 to 20 years, that's your undergraduate, that's your medical school, that's additional exams after medical school, that's board certifications in bariatrics. See, it's getting very specialized. And these certifications have to be through the American Board of Obesity Medicine and American Board of Medical Specialists and the National Board of Physicians and Specialists. That is a lot of exams to go through. So when you specialize, remember, a family practitioner is just that, someone who generalizes all, just overall medicines to try to help you. So then they can, those common things that we go through. But when you start moving into chronic diseases, you need to see a specialist. Whenever you have a long-term issue, it's time to see a specialist and advocate for yourself. If your blood pressure has been up for a long time, if your sugars have been up for a long time, if you have been dealing with your weight a long time, right? Think about it. If you've been having some heart issues for a while and you haven't seen a specialist, why not? Ask your doctor to see a specialist. If they say, well, you have to do some additional testing, then do the additional testing. But you need to see a specialist because remember what I said, a specialist goes beyond what your family practitioner is going to do. Okay, so keep in mind, we had one of our doctors, nurse practitioners online, and she came on, and Dr. Fatisha Andrews has gone to medical school for nurse practitioning. So keep in mind, in a family practice, a nurse practitioner can see patients just like a family practitioner doctor sees patients, right? So think about that. Now, If you want to specialize and see people specifically beyond that, then you go to school longer, because now you're getting into specific things. And if it's surgery, you're going to school longer. So now you can specialize, because you wouldn't want your family practitioner operating on you because they may not have gone to school for surgery. Think about what I'm saying to you. So you want to make sure that whatever doctor you're seeing is specialized in your situation. And especially if a doctor or family practitioner says to you, this is a chronic disease. The minute they say that, doctor, I need a specialist. I need a specialist. And you can still go to your family practitioner, because your family practitioner should be looking out for you, and they should be telling you about all the things that you have options on. Remember, we're talking access, we're talking information, we're talking advocacy, we're talking all of these things. You are paying for this service. And so I'm saying to you, these are occupations that people choose to go into because they want to help people. So let them help you. Let them help you. Okay? But remember, you have a voice in this. You have a voice to advocate for yourself when you're in that office. How do they treat anyone diagnosed with obesity? That's a good question. The first thing I would say to you is to visit the specialist, and they will provide you with an exam. Now, remember, you went through exams and you went through different things with your family practitioner, but it's going to be a little bit more detailed and specified for what you have seen the specialist for. So if it's for obesity, of course, they're going to do your BMI. Even if you've done it already, they're going to get your history from your doctor, and they're going to ask you personally. They're going to discuss foods with you that you're currently eating, and they're probably going to ask you to journal for a period of time. And you should have already been doing it, because you and I have talked, and you're going to see that specialist. So if you're going to see that endocrinologist, or you're going to see the bariatric healthcare provider, right? Come on, whoever you're going to see, you should have that journal of foods. And then what exercise are you currently doing? And they're going to talk to you about what you could be doing. They're going to talk about your eating habits, right? And because we're communicating, you should have already been able to tell them, I used to do this, now I'm doing this. And then they're going to also talk about other health benefits of if you take these opportunities to do this and that. And then they're also going to talk about your mental health. Now, that's huge, because every specialist that I've ever gone to, every doctor that I've ever gone to, they always ask me, how are you doing, Shirley? So your doctor should be asking you that too. How are you doing? They should be doing a mental health check. Now, in my occupation that I am as an educator, this is something that my mentor has taught me to do every time I see a student or I talk to a client. How are you doing today? And take a few moments to listen, right? Because if you listen, you're actually going to hear the truth. No matter what anyone says, you're going to really hear what they're saying. So take that time. I say put that in your pocket and use that for another day. Okay. And then they're also going to talk to you about complications that you've been having. And they're going to ask you, what is your thoughts on this? Why are you here today? You know, even though it's very common knowledge of why you're there, but they want to hear what your opinion is on that. And this is your moment to speak for yourself. This is your moment of advocacy for yourself, to talk and say that. And you know, if you're going to the doctor and you can't really speak up for yourself, make sure you're writing everything down. Have someone, have a buddy, have someone go with you to the doctor's office. And when the doctor's asking questions and you may not say anything, your buddy is going to speak up, and they're going to speak for you and say, well, doctor, because I'm here and this person, whoever is not telling you, this is what's going on with them. In my life, if I feel that, or I'm a little shy, I take my mom with me, or I take my sister with me, or I take my husband with me. Very rare did I have to take my children with me. But I will, if I feel that for some reason I can't speak up in regards to a matter, I'm going to take someone with me. But I think the moment that you take the time to speak up for yourself the first time, you're going to notice that it feels good. It feels good to say, you know what, doc, I need a specialist. And then stand your ground. They're also probably going to take some glucose tests, thyroid tests, cholesterol tests. This is the norm. They're going to take a lot of blood tests, kidney tests, vitamin D level tests. They may even put you through an exercise test if you're going in through something in this. It all depends on what your history is. Remember how every doctor you're going to talk to is always wanting to know what is your history, because they compile all these things together and they diagnose you off of the history and the different things that we are, that they know about you. If they don't know something, they can't compile it together and then get a better understanding of who you are, right? But you have the 3 different occupations that can help someone who is going through obesity. And the first one was the endocrinologist. The second one was the gynecologist. And the last one was the bariatric healthcare provider, or bariatrician, or we call them a bariatrician surgeon, depending on what it is that they are going to do. But I also want to add one more thing that I have forgot to add, that if you are thinking about becoming a gynecologist, sometimes people also say they are OBGYN, but that's only if that individual is going to be delivering babies, right? Not just your gynecologist in addressing your female parts, but if you actually are going to have a baby and they need to deal with reproduction and all those type of things, then they go to additional education. They get additional education, so then they can be your OBGYN, because remember, they have to sometimes, not sometimes, they have to deliver the baby, and sometimes they have to give you a C-section, or sometimes operate. So those are 2 different things. So you have one who's a gynecologist, and you have an OBGYN who's going to be delivering babies and possibly doing surgery. So 2 different things, and there will be additional education. Okay, so I just want to make sure that we clarify that. All right, so I want to talk to you about our ending session, which is as always, I want to talk to you about today donating to Encouragement on Fire, which is also under HouseBreachRestoration.org, under the Meeting House, which is a 501c3 nonprofit organization. We are, our focus is to make more awareness of chronic diseases throughout the year. And we are focused on getting on as many accessible social medias as well as in the community, partnering with others to make sure that we bring this awareness. It is one of the passions in my heart after going through what I went through this past year. And I'm just excited about being a part of this all. So if you believe in what we are doing and sharing information, I encourage you to go to the QR code that is in front of you with your phone, and to donate. Like I said, it doesn't take much, whatever you feel that you should. Okay, and we appreciate it. And like I said, give us your information, and it is a tax write-off to you. This is one of those services that we are providing our community. some wonderful things have happened to us. So I wanted to bring attention. I'm pretty sure that at the bottom here, you are looking at what we are scrolling by. We have our HouseBreachRestoration.org website on there, and for you to donate that way as well. But I want to bring to your attention that in 2023, we also have a company called I Am One of a Kind. And I have the information below. And this is a clothing boutique in Pennsville, New Jersey. This is Lady Crystal. You can just ask for her by name when you get there. But Lady Crystal will be dressing me for the entire year. So kudos to you. I went to her boutique. It's wonderful. And so she is donating clothes throughout the year for me to dress. So then you guys don't have to look at my boring wardrobe. How about that? And that there will be some nice, colorful outfits for you to see. So if you are interested in any of the clothing that I have on, if you go to her boutique information below, you will be able to purchase it online, and you can also go there in person. If you go to her in person, make sure you tell her that Encouragement on Fire, Shirley Farrar sent you, okay? I want to go back to our telephone number. We have our phone line now, 856-857-1859. For anyone who wants to tell a testimony, please leave us a testimony. We would love to share some information of what God has done for you. Or if you feel that this is something that over the years, going to the doctor or having support in the community, or there was a resource that you didn't know about, and once you did know about, it helped your progress. Whatever it is that you want to testify about and tell how, you were blessed to have that information, we want you to provide us that information at our telephone number. Again, 856-857-1859. And give us a call if you need prayer. It's really important to us that when we are in our prayer time, that we take that information to the Lord in prayer. All right, everyone. So we are at the end of our program for today, and this is the last of our talk on obesity for the month of March 2023. For the month of April, we will be talking to you in regards to another chronic disease, and this chronic disease is Crohn's disease. I want you to make sure that you tune in so you can hear some information in regards to that. And we will also have occupations that deal directly with Crohn's disease by the end of April. Okay? So again, I am Shirley Farrar, and this has been Encouragement on Fire. And I just want to say to you, have a good evening. Talk to you soon. Bye-bye.